mindful that you're doing videos, but I want you to make the mistakes that is necessary so that other people, when they watch it, they understand. You don't show them the video until they finish putting on them probably the correction part, then will start making sense from that time on. So once you've already put in your scrub in the hospital, now you don't have anything that is personal on you.
Correct.
The only thing that now you need is what you're gonna put on and what you're gonna take off when you come to the hospital, and then you get back to how you are when you first came in. So the way we put on PPE is a sequence. Now, if you are going to put on a scrub, we encourage you to put on the bouffant first.
Okay.
The reason behind that is the bouffant controls the hair, and sometimes when we are in the operating room that is a sterile site, the hair sometimes may fall on our scrub when we are putting the bouffant. So those hairs can then get into the sterile environment when patient is open or the instrument. So the first thing is always this, please, if you want to use one.
Yes.
Okay, good.
No thing.
Good. And I will always let you make mistake, then I'll correct you. Normally, before we put on our hand in anything, the first thing we do, we try to do hand hygiene.
Hand
okay?
hygiene.
Exactly. Always make sure that
And hygiene before you put your hand in water.
in anything, once you do done hand hygiene and you start donning, it's okay. Until then, it's time to take it off. Okay? So you don't do hand hygiene in between any of these.
So hand hygiene first, right now with the hand hygiene, then we go ahead.
You grab your bouffant. Once you put on your bouffant in the room, then before you put on your scrub, but let's say that you just finish putting on your bouffant and scrub, the next thing you put on is what? What do you think?
Gloves.
You put on your gown.
Gown. Gloves and then gown, gloves again.
No, just put on your gown.
Gown.
Remember, this is a clean process, it's not a sterile process.
Right.
So in case if you guys are two, one of you will try to fix the other one. Okay, so you turn around, consider that I've already performed hand hygiene, that I can fit, make sure that it's well fitted, and you are covered. As you can see, your back is totally exposed. Okay, the goal is to make sure when you put it on that you're actually covered. Okay? That's much better now. Okay. So when you put on your gown, what do you think will be the next thing you put on?
Gloves. We all have facial dinner earlier.
So you cannot put on a glove. Is this your size?
Yes.
Always make sure if you have an option to put on glove, you're putting the one that is your size, because it makes it more easy to work with. Okay. So now that you have everything you need on, putting it on is actually not a problem. Most times evidence have shown that we get contaminated, we get cross-contaminated when we are taking them off. That's where the science and also the carefulness comes in. You see, when I ask you to put on the glove, boom, you put it on. But the point is that when I ask you to take it off, that's where the issue is. Most people sometimes, when you tell them to put on gloves, the first thing they do, they just grab the gloves and put on. The first thing you do is perform hand hygiene before you put on gloves. So I intentionally made you to believe me that you will first put on the everything before you put on your glove. The first thing you're supposed to put on is actually the gloves. So when somebody tells you to do something wrong, always question the person, are you sure he's stepping it? That's why I told you to do it, so that you know it's always okay to say, stop, let's clarify this. So you perform hand hygiene, you let your hand dry. Don't perform, no, let your hand dry, then you put on your gloves, you put on your gown, you put on your mask. Okay, but you already come out from the clean room with the buffon, the scrub, and the booties. Okay, so now you are ready to go pick up your patient, and your teammate is already the same way you are ready. You have everything you need. So once you finish delivering your patient, and then you go through taking them off. So when you get to the room where you're going to take it off, the dirty room that is on this side, then that's when we're going to start taking it off. So what do you think is the first thing you take off?
You take off your gown first.
You take off the gown first. Tell me why.
Well, because you're going to roll it out and you're going to peel away from you all the...
So evidence have shown when people roll it out and peel, chances of cross-contaminating themselves is also there. The first thing you will do is you try to take off the gloves first, because the gloves is the dirtiest thing you have.
So then these will come off first.
Let's follow that. That's actually the right sequence. You take the gloves off. You can peel both of them off. That's another way to take PPE off. But I'm trying to minimize any chance of exposure. When you take it off, and I'll tell you the reason why. So let's figure out taking these gloves off first.
Okay. Take them off first?
Yeah.
What are you going to do? And then you're going to keep them and then you're going to pull.
Okay. So you've
From the
taken
back.
it off. Okay, I'll take it.
But no, you don't keep on holding on to them?
Thank you. So good. When you take the gloves off, even if it's Jesus Christ that is asking you to give it to them, don't tell them no.
Right.
I intentionally ask you to give it to me.
But you hold on.
But there will be a trash can there in that room. There's a big trash can there. So once you take it off, you put it in the trash can. Okay? And then when you take it off, what do you think is the next thing for you to do?
You gotta take off your gown.
Okay. So that is what people always miss. Once you take off your gloves and you have to do something else, the first thing you do is what I told you to do at the beginning.
Hand hygiene?
Good. Evidence have shown that people always forget that they have to do it after they remove the gloves. Glove is not as safe as we think it is. They have what we call micro tears, and sometimes the glove might be torn, but you don't have a microscopic eye to see it. So always perform hand hygiene before you put it on, and once you remove it, perform hand hygiene again. Now, because you still believe that we still believe you are dirty, once you remove it, try not to put your hands together. Always make sure your hands are not touching any part of your body. So you're going to perform hand hygiene, and then there will be a runner that will give you the sanitizer to do hand hygiene. Once you finish that, I'm going to encourage you to put another clean gloves.
Clean the gloves. Is that correct?
Yeah, that is very correct. That's the way we're going to do it. Now you remove the most dirtiest thing. I'm going to ask you to put another clean gloves, because now it's time. Now you have a clean gloves, but you have a dirty gown. So now even if your gown touches your hands, it's gloved with clean. So now we take off the gown.
Okay.
Yes. So I'm going to teach you the right way to take off the gown. I prefer you don't pull it. I prefer you don't do this. I prefer you take it off the way I'm going to show you.
Okay.
So first thing first, you break the seal.
Which is here.
Yeah, take it. Good. Now, do you have a runner that will help you? You can turn around.
Okay.
To them with a gloved hands, they will help you. Oh, wait, when I ask you to, you go. Do. So now, with this hand, you can grab the inside of this, and then with this hand, go, keep going. Now you keep taking them off, and as you take them off, you keep it out of yourself. Okay. So keep rolling it together, inside out, the same way you are doing. Keep going. Keep squeezing them. Good. You see, right now you have a clean gloves, right? So even if your hand touches this your body, is clean. You've taken off the one that may have touched the patient or the patient environment. Keep rolling. Good job. Okay. Keep squeezing. Keep getting your hand out. Good. 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 Right there. When you get there, then there'll be a trash can. You put it in the trash can. Okay, go ahead. Let's say you put it in the trash can. Now, what do you have in your hands?
Dirty hands.
Okay, dirty hands. What would you supposed to do?
We'll take off clean,
Take off the gloves.
clean
Yes.
hygiene again.
Yes, good job. But now you've done one thing twice wrong. So I'm gonna stop you now. This is the way you're actually supposed to take off your gloves. So I perform hand hygiene. I'm gonna put these gloves on, and you see the right way to take it off.
Okay.
There is no right way to put it on because it's called clean gloves. If it's sterile gloves, there is a right way to put it on. We put our non-dominant hand first before our dominant hand, but it doesn't matter. This now is a clean gloves. The right way to take it off so you don't cross-contaminate yourself in any way, shape, or form. People try to do this. You see what just happened?
Touch.
My finger have touched my skin. The right way to take it off is you pick the gloves in the middle, dirty to dirty. Inside the glove is considered clean. Why? Because I perform hand hygiene before I put it on. So once I create a vacuum like this, I can just take the gloves out, inside out.
Gotcha.
Okay?
From the palm.
Yeah. And now I have a clean hands. With my clean hands, I can actually do this. And then the same glove, inside out, I can put it in there. I can actually touch the gloves with my clean hands inside because the inside is considered clean. But the most important thing you need to do, pick the gloves from this part of your palm, not here, from here. Pick it, and create a little vacuum, and then slide your hand out. And then with your one finger, you can get into this one, and then you take it off inside the trash. And immediately perform hand hygiene, and then put another one on.
Hand hygiene?
Because you need a clean hands to go to your, take off your mask. You don't want to cross-contaminate yourself with that clean glove you thought you have. But after you remove the gown, there's possibility of cross-contamination. So by the time you finish taking off this, you may take off your gloves 3 or 4 times.
Okay.
But when you take off each glove, you do what?
Hand hygiene.
Good. So if you're gonna take off your gloves 3 times, how many hand hygiene should you do?
There should have been 4 because you do
Good
one
job.
more time.
Number of
the end.
gloves plus 1. Most people will answer 6, and it's wrong. It's always numbers of gloves you're gonna take off plus 1 because
The
it will
last
be
time
before and after. Good. So now the next thing you need to take off is your
The mask.
mask. See, right now, it's okay to reach to your bag because of what? You
Yeah,
have
clean
high
gloves.
confidence that you have a clean
Clean
gloves.
gloves.
Yeah, clean hands. Good. Okay, now that is the mistake everybody makes when they remove the mask. You do not take off the upper thigh first. You take off the lower thigh first. And I'll demonstrate that for just leave your own the way it is. I'm going to put on one. Consider my hand is clean. I'll put on a mask and I'll remove it. You see yours and see mine. So I'm going to put on my mask. Like the way you tied it, you tied your upper one first, which is the right thing you did. You tie your lower one. Both of the ties are not supposed to be lower or upper. One is upper, one is lower. You make sure you fix your marks very well. It's not a marathon. Take your time. So now to remove it, I'm going to remove mine. You removed one tie. I'm going to remove one tie, and then we're going to look at both of us how we are. So I'll remove one tie from mine. So how is my mask?
Still covering your face.
Good. But how is yours?
It's open.
On
So
your
what
neck.
is the different thing that you did that I didn't do?
Or I untie the top.
Exactly.
To drop.
Exactly. Always untie the lower one first. Now when you untie this upper one, just slip knot, pull it. I have the mask. It doesn't have to fall on me.
Yeah.
No,
So
I have the mask
so you
out here. So always tie it back up again, please. So you can remove it the right way.
yes, sir.
It's always good to make these mistakes when people they see what you just did, then they understand what they're doing wrong. Every time when you tie your mask, the first thing you do is check the nose bridge by fixing it, push it exactly, make sure that it snugs to your face. Now remove the mask. Good, right there first, and then the second one, as you're removing it, you're holding it so that it comes straight out. You don't really need to go through untying it if you didn't tie where you can actually cut it too, because you can cut it and then just right there, grab it straight to the trash. It didn't touch any other part of your body. And after you did that, what else you supposed to do?
Gloves come off.
Gloves come
Hand
off.
hygiene when we're
And hygiene. But it's not necessary anymore because it's not necessary. You need to take off. You're going into the bathroom, so you don't need to put another one. So take it off. And then, do you have to take anything else off before you go to the bathroom? You can take that one to the bathroom because same place you will leave this one. That's where you leave that one. Or you can take it off in the room. But there's one thing that I really want you to take off. Booties. Because remember we told you once you cross that second door, what happened?
it's clean.
It's clean. And this is the most dirtiest thing you have for you with you now. So I'm gonna encourage you to take it off. And which way do you take it off?
Well, first we gotta do put gloves on again.
Do hand hygiene.
Hand
put on
hygiene.
hand. You see now it becomes a little bit cumbersome.
Yeah.
But people don't think about it in the regular day-to-day activity. Yes, so you do hand hygiene.
Hand hygiene.
And then put on gloves.
So multiple hand hygiene and multiple gloves.
Multiple hand hygiene and multiple gloves. And the key behind that is that you try to make sure there is no opportunity for cross-contaminating your person, because the only tool you have in taking off the PPE is your hands. That's the only tool you have. So as long as you clean it and put a clean gloves in it, you will not contaminate it. Even if you are, the cleaning process will actually demise the pathogen. And in that room, did you notice anything in that room where you're supposed to be taking off this?
Which one?
In the dirty room over there, there was something there.
There's a big trash can.
There's a big trash can and there's something else.
Hand sanitizer on the wall.
There's some sanitizers and there's a chair. But the chair they put in the room, but that chair is supposed to be in this room. Evidence has shown when people try to remove this, they fall. So
sit down.
you need to sit down. When you sit down, it's more easy for you to reach it to remove it. You are in very good shape. It will probably be easy for me to do it, but some people are not as in good shape as me and you or him is. Some people are probably, by the time they do this, they hit the floor, they break, or dislocate something. So we encourage you to sit down. I'm going to give you a chair. And that chair is considered a dirty chair. It's a plastic chair because after you sit in it, somebody can wipe it down.
Wipe it down.
You put there. So I prefer you sit down. Yes, it's okay. And then you remove your booties. Or since you're going to remove your booties and your buff on the same time, you can use the clean gloves to remove your buff and guide.
So clean gloves.
Remove your buff and then while you are there, you cannot remove your booties because it's a dirty thing.
Yeah, but
So the right way to remove the booties, I will encourage you to grab the booties outside.
from the outside or from
Yeah,
the
grab it from outside. Yes, pull it and then pull your leg out. Raise your leg up. Good. Don't try to touch your shoe. You see the way you did it? You didn't touch your shoe.
Yeah, your hand not touch the shoe. Yeah.
Go ahead. The other hand. The other hand, grab the booties. Yeah, good. Slip it out. And now you can get up. And then when you remove your gloves, this time you are done with gloving. But I want you to remove the glove the right way. Don't pull it too hard so it doesn't tear. Just you're trying to create a vacuum. Exactly the same way you did it. That's the perfect way to remove gloves. That's it. So we do it over and over and over. It becomes very easy to do. But that's the right way to do it. Hand hygiene, and then you step out of that door. You are not going back again.
No.
You are not going back again.
Yeah,
You just come out,
keep on
and
going
then you go into the
to the
bathroom.
Wash
You
your
are going into the bathroom to do. You don't need to take a shower if you don't want to. The shower is provided for you there because it's like 5 minutes drive. But if you've worked in this unit for 12 hours, we're going to encourage you to take shower before you go home. But then we don't want you to leave this unit with this scrub. You might think it's clean, but we prefer that you leave it for us here and get a new one. That's why you have to visit that other room to change.
to change again to a different scrub.
To a different scrub. You remove this one. But now we can consider that you are partially clean, but you still have to perform hand hygiene before you walk across the room to go to the other room. Then you change. And once you come out from there, you head into the door to go out to get your partner. And then your partner will come through the same process. So the scrub you came in with is not what you're going to leave out with.
Right. So a new set. That's the last thing you do when you walk out of here.
That's the last thing you do when you walk out.